Hello, everyone. My name is Dorota Napierska. I'm Chemicals Policy and Project Officer at Healthcare Without Harm Europe. And I will say today a couple of words about our work on safer chemicals. Our organization is a non-profit European network of hospitals, healthcare systems, and professionals. We all are working towards reducing the environmental footprint of healthcare sector. And even if our members are based in Europe, through Global Green and Healthy Hospitals networks, they are also connected to many other hospitals and health centers all around the world. So the overarching goal of our work, so-called Safer Chemicals program, is to reduce human and environmental exposure to toxic chemicals in healthcare. We do it through raising awareness amongst the healthcare sector and also policymakers, and also through active and proactive advocacy towards policymakers on toxic chemicals in healthcare. We try to increase commitment of the healthcare sector in Europe to use safer medical devices. And we advocate and increase commitment also of healthcare sector to reduce the health and environmental impact of products, especially on the chemicals contained in these products used in the healthcare sector. From those products, we recently focus on dental amalgam, disinfectants, and medical textiles. So, of course, if you work on the chemicals, you really have to know well how they are regulated. And in Europe, we have actually currently almost 40 pieces of different legislations on chemicals. But those who are really important for the healthcare, there are basically two. The first one is REACH, Registration, Evaluation, Authorization, and Restriction, horizontal pan-European regulation that basically requires to register all chemicals that are produced or imported to Europe, and manufacturers has to provide toxicological, ecotoxicological information on those chemicals. And then once such a chemical is actually recognized and of high hazardous one and needs to be restricted, it happens by placing this chemical on so-called candidate list for authorization. So manufacturers have to basically ask for the permission to use such a chemical. But also has to be said that in case of medical industry, this is medical industry is exempted from this regulation. So if this chemical is, for example, assessed as hazardous for human as reprotoxic, then manufacturer do not have to ask the permission. But once the same chemical is assessed, for example, as endocrine disruptor for environment, then such application is necessary. But the core regulation that is very important for the medical industry and of course healthcare sector in Europe is a new medical devices regulation. This regulation has been adopted in 2017 and will be finally implemented actually this month on 26th of May 2021. And this particular regulation is also addressing better hazardous substances. So those substances that are recognized as carcinogenic, mutagenic, reprotoxic, or endocrine disrupting chemicals in invasive medical devices above concentration of 0.128, they actually can only be used in medical devices if the manufacturer will prove that there are no alternatives and that the use of those chemicals actually outweigh the risk. Also, all those substances have to be clearly labeled. And at the end, it's still not implemented because of some delays, also due to COVID. But we hope that next year, the so-called EUDAMED database, so European database that will include all medical devices marketed in Europe, where you can also find information of technical information, including the substances, and this database should be actually made available. When it comes to the chemicals, where there are many of them, unfortunately, that are hazardous both for human and environment. Our priorities are so-called endocrine disrupting chemicals, chemicals that are carcinogenic, mutagenic, and toxic for reproduction. Phthalates, also bisphenols, I didn't really list it on the slide. So those actually chemicals who are clearly related to plastics. Mercury, biocides, per and polyfluoroalkyl substances, and finally nanomaterials. Just wanted to say a couple of words about endocrine disrupting chemicals, because actually those chemicals are still not really so well regulated at the EU level, and this is part of our advocacy, also other non-profit organizations in Europe. While actually in the last 20 years, definitely the amount of evidence linking exposure of humans to endocrine disrupting chemicals and many harmful effects in humans, such as reproductive effects, neurological effects linked to diabetes, obesity, cancer. So there is definitely need to do something about it. At this very moment, actually, those chemicals are only clearly regulated in biocidal and plant protection products regulation, but also the criteria that are setting very high requirements to prove that such a chemical is actually hazardous. So we are currently also advocating for, first of all, putting one definition to all regulations. Secondly, not only include those chemicals who are proved to be, but also suspected. Unfortunately, since 2019, we have many new leaders in the European Commission, including the President of the European Commission, Ursula von der Leyen. And the European Commission made actually recently really clear commitment to improve the situation, and also so to improve general management of chemicals towards a zero pollution ambition, and also apart from regulating those very obvious, let's say, problematic chemicals polluting air, water, also pesticides and endocrine disruptors are listed. And Healthcare Without Harm Europe is part of pan-European EDC-free Europe network, which is actually very active in doing the advocacy on a European level. I just wanted also to say that we actually know very well that those chemicals are present in the products, and not only in healthcare, they are present in the consumer products, and even very recent assessments show that they are present in products like cosmetics, toys, food packaging. Practically majority of furniture we have at our houses contains some of them. And also very worrying, but also practically all biomonitoring studies show that we have these chemicals in our bodies. So there is the reason to really be concerned. And there are many of those chemicals also present in the healthcare sector, in medical textiles, cleaning products, flooring, gloves, which we hope that most of them will be phased out soon. And then medical devices. So especially those plastic ones like intravenous tubing and bags are quite problematic, because that means basically by using this equipment and providing, of course, necessary treatment to the patient, actually those chemicals which are used to make the plastic softer, they are leaching from this plastic. So they're actually coming directly to the body of the patient with the treatment, medicine, fooding, etc. And while, let's say, for a while, maybe it was not sure how high this exposure is, and there were debate, should we really worry about it? The independent scientific committees on the European level made really very comprehensive revision of existing evidence, literature, and they make a clear conclusion that premature neonates, infants subjected to repeated medical treatment and dialysis patients are at risk of exposure to phthalates, and main phthalate use is actually DHP, and bisphenol A. So there was actually no really doubt that this exposure is and is almost at the really high toxicity level. Although, again, that's endocrine disrupting chemicals. So we have to be aware that those effects are not appearing immediately. They can actually appear really 10, 20, even 30 years later in the lifetime. And that's why maybe it's so difficult really to get those chemicals regulated. But we sincerely advocate also to, especially towards the healthcare sector. So one thing the regulatory bodies should remove, should really support research and replacement of all those problematic plastic medical devices through better, let's say, made from better, safer material. But we also are showing sincere that many alternatives, in fact, are already on the market. In 2014, we published a report called Non-Toxic Healthcare. And in 2019, we also published second updated edition of this report. And actually, this edition is also since recently available in Spanish. And I also recommend also to check the report from our workshop we had in 2019, when there is the link to many, couple at least, of interesting presentations and updated situation, also from industry, showing how many PVC-free and DHP-free actually medical devices are already available. And then just really short, just to show some other, well, problematic products and definitely problematic chemicals in those. So maybe you may be aware of Minamata Convention. This is the convention who is regulating the use of mercury, one of the top 10 toxic chemicals as assessed by World Health Organization. But in Europe, actually, we even have more strict regulation that was introduced after joining the Minamata Convention. So, for example, this particular regulation is already since 2018, banning the use of dental amalgam pregnant women, in children under 15, and also the dentists are also required to install a special equipment that is and of course fulfilling the same role. So it must be really efficient in killing the microorganism. Case studies, we also touch on a non-chemical alternative solution and give some recommendations. And finally, just to mention that we also started to work more on medical textiles, and this work became very useful last year, because also part of those, as you know, personal protective equipment that became, I think, one of the most used medical textile in the last year due to COVID-19. So that's also those textiles we are addressing. One thing is that many of them are, at least in Europe, are disposable, and that produce huge amount of problem of waste. Medical textiles are they cause a high impact on the environment through their production, use, and disposal. And as listed here on the slide, there are many really chemicals that they can contain, and they are released also during use, but especially during disposal. So that's really cause a huge problem when we think about amounts of those products we are using these days. And we actually working hard also to understand and to push manufacturers, first of all, to disclose information, what they use to produce those particular textiles. This information somehow is more easy to get when we talk about classical medical devices. Medical textiles seems to be more difficult to to really understand. But we are working on this, and we hope there will be some progress. And this is my last slide, just to mention that we also have a dedicated work stream on waste. We try to basically, in the concept of European circular economy, we are trying to find the best ways how to avoid waste. So this is the best waste management is to avoid it, to prevent creation of waste in the first place. This is, of course, not so easy maybe in the healthcare system, but there are many possibilities. And then once we have this waste, we still think it can be better managed. Some things can be better reused, some things can be recycled. And disposal is still very problematic because it's mainly incineration, and this is the most non-friendly environmentally way of disposal, let's say. So that was my last slide. Thank you very much. You can definitely take a look on our website. I believe there is also website in Spanish run by our colleague from Latin America, which I think that other colleagues from my organization will provide you. But on our site, you will definitely also find a lot of useful resources. So I invite anybody to, if anybody is interested, please check it. And I'm always very happy to answer any extra question you might have. Thank you.
Estimado Augusto, ¿puedes detener la grabación, por favor? Augusto.
Sí, señora, ya detengo la grabación.